internal medicine. All right. Okay. So we have a young girl with her mother who visited your facility with a progressive hair loss, okay, over her scalp, which started few days ago. A young girl, and then there's what? Alopecia, isn't it? Which started few days ago. So let's look at what the questions are. Common causes of alopecia in children. Common causes. Common causes. So one, you can talk of tinea capitis. Most of us know it as the what? The ringworm infestation or the ringworm infection. Ringworm. Ringworm. So tinea capitis. You can talk about androgenetic alopecia. Androgenetic alopecia. You can think of alopecia areata. Alopecia areata. You can think of traumatic alopecia or traction alopecia. If you want to talk about traction alopecia, we are referring to the kind of injuries lady inflict on themselves, especially when they go to do their braidings. I mean hair braids or straightening of their hair. It can lead to what? Loss of hair from their head. Okay. Then the alopecia areata. Visually, this is an autoimmune disorder in which your body attacks your own hair follicles. Your own hair follicles. So that is what? Alopecia areata. Alopecia areata. Then we have the androgenic areata. Sorry, alopecia. Usually this is what we normally call we normally call it bald or baldness. Baldness. But I think in children you can't find this kind of baldness in children, maybe. But definitely moving forward, you might want to look at androgenetic alopecia. Androgenetic alopecia. Then you can also have alopecia as a result of chemotherapy. You know, those who have cancer, you read that they have no hair, isn't it? That's because that type of hair loss, we call it telogen effluvium. Telogen effluvium. Telogen effluvium. The effluvium, EFFLUVIUM, effluvium. Effluvium. Basically, these are things that you need to know. But there are some too, psychological in their brain. They are just born to steal, isn't it? They are born to steal. They are born to steal. So we have another type for people who are just born to, or their hair is just removing just like that. Yeah, those people are also there. Or due to stress, due to anxiety, and things like that, they can also be considered. And sometimes we call them the trichotillomania. Trichotillomania. So they'll be there, they'll just be removing their hair as, I don't know, maybe stress, maybe anxiety. So they're just removing their hair. All right, so these are the basic, the cause of alopecia, basically. All right. Classify alopecia. Okay. Now, alopecia can be classified into two. We have the scarring and then the non-scarring. Now, when we talk about scarring, definitely, as the name implies, there's scarring at the end of the alopecia. You don't see any hair probably again, isn't it? So there is fibrosis and permanent hair loss. Fibrosis and permanent hair loss. That is the scarring type of alopecia. Then we can talk about the non-scarring type of alopecia, whereby, of course, the hair can always grow back or return. Hair can always return. All right. How will you treat hair loss? How will you treat hair loss? So basically, you can treat hair loss, topical and systemic immunomodulant or modulatory agent. Immunomodulatory agent. So topical and systemic. Then you can do patient education. Especially those suffering from traumatic alopecia, where they go and do their braidings, their hair, and at the end of the day, hair is being lost from their head. So they can be some education. Then people with that kind of maniac problem or psychological problem, that's trichotillomania people. What you can do is that you can give them the SSRI, that is selective serotonin reuptake inhibitors. You can recommend these kind of things for them. So all of these can help in the management or the treatment of alopecia. All right. All right. So thank you, ladies and gentlemen. I appreciate your time with me. But if you have any question, please feel free to write it in the comment section. If you have any addition, please contribute and let's make this place a better place. Let's make learning fun for everyone. All right. So see you in the next chapter or in the next tutorials. Bye for now.